Respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 32nd lecture on systemic pathology. Today, day 2 of diseases of cardiovascular system. Day 2 of diseases of cardiovascular system. Dear audience, today's topic is Glomus tumor. Before going to discuss about glomus tumor, we have to recapitulate the tumors of blood vessels. Tumors of blood vessels. Tumors may be benign tumor, benign tumor of blood vessel is known as hemangioma. And this hemangioma may be capillary hemangioma, may be cavernous hemangioma, and may be glomus tumor. Malignant tumor, hemangiosarcoma, hemangiopericytoma, dear audience, hemangiopericytoma arises from the pericyte of blood vessel. Kaposis sarcoma, dear audience, Kaposis sarcoma may be found in AIDS patient. It may be found in AIDS patient. So, tumors of blood vessel may be benign tumor. The benign tumor of blood vessel is known as hemangioma. Hemangioma may be capillary hemangioma, cavernous hemangioma, glomus tumor. Malignant tumor may be hemangiosarcoma, hemangiopericytoma, Kaposis sarcoma. Dear audience, now come to glomus tumor. It is known as glomangioma. Glomangioma, that is glomus tumor, is a benign tumor of artery and it arises from the glomus body. It is a benign tumor of artery that arises from glomus body. Dear audience, again, glomus tumor is also known as glomangioma. It is a benign tumor of artery that arises from glomus body. Now come to what is glomus body. Glomus body is a modified smooth muscle cell of blood vessel. It is modified smooth muscle cell of blood vessel. That is, it is modified smooth muscle cell in artery. It is neuromyoarterial receptor. It is neuromyoarterial receptor. It is sensitive to variation of temperature. Glomus body is modified smooth muscle cell of blood vessel, that is modified smooth muscle cell of artery. It is neuromyoarterial receptor. It is sensitive to variation of temperature. It regulates arterial blood flow. Dear audience, this body is situated on the wall of the artery. As it is sensitive to variation of temperature, it regulates the arterial blood flow. The glomus body has afferent artery. It has arteriovenous anastomosis, arteriovenous anastomosis, and efferent vein. Again, it has afferent artery, arteriovenous anastomosis, and efferent vein. If this is the afferent artery, this is the arteriovenous anastomosis, and this is the efferent vein. So, this is the afferent artery, efferent vein, and this is the arteriovenous anastomosis. Again, glomus body is a modified smooth muscle cell of artery. It is neuromyoarterial receptor. It is sensitive to variation of temperature, so it regulates arterial blood flow, and it has afferent artery, arteriovenous anastomosis, and efferent vein. Dear audience, now come to sites of glomus body. This glomus body is located throughout the skin. It is especially located in the distal part of the finger and toe under the nail. It is located throughout the skin, but especially located at peripheral part of finger and toes under the nail. So, it is distributed throughout the skin, but especially it is located at the distal part of the finger and distal part of the toe under the nail. Dear audience, if anybody suffers from glomus tumor usually found under the nail of finger or under the nail of toe. What is the presentation of patient with glomus tumor? Presentation of patient with glomus tumor: very painful pinhead size tumor, very painful pinhead size tumor under the nail. Suppose this is the finger and this is the nail. Under the nail, pinhead size tumor that is very painful, like this. This is the pinhead size painful tumor under the nail. Dear audience, if we do histopathology of such a small tumor, what may be the findings? Now come to histopathology of glomus tumor. Histopathology of glomus tumor reveals branching vascular channels, and the vascular channels are separated by connective tissue stroma. Channels are separated by connective tissue stroma. Within the stroma there is glomus cell. Within the stroma there is glomus cell. So branching vascular channels are separated by connective tissue, and within the connective tissue there is glomus cell. Cells are uniform, cells are round to cuboidal shape, and the cells contain scanty cytoplasm. The cells like this, and they have got scanty cytoplasm. This is the nucleus. These are the glomus cell. So histopathology reveals branching vascular channels. This is branching vascular channels, and the channels are separated by connective tissue stroma. And within the stroma there is glomus cells. These are the glomus cells, round to cuboidal cell with scanty cytoplasm. This is the histopathological findings of glomus tumor. Dear audience, today I have discussed briefly about the glomus tumor. It is a benign neoplasm of artery. It arises from the glomus body, and you know glomus body is a modified smooth muscle cell of artery. It is neuromyoarterial receptor. It is sensitive to variation of temperature. It regulates arterial blood flow. It has afferent artery, arteriovenous anastomosis, and efferent vein. It is distributed throughout the skin, but most commonly it is found under the nail bed at the peripheral part of the toe and fingers. The tumor is pinhead size, very small tumor, but it is very painful. Histopathology reveals branching vascular channels separated by connective tissue stroma, and the connective tissue stroma contains the glomus cell. Cells are uniform, round to cuboidal shape with scanty cytoplasm. I have discussed briefly about the different types of tumors of blood vessel: benign tumor, hemangioma, maybe capillary hemangioma, cavernous hemangioma. Another one benign tumor is glomus tumor. Malignant tumor may be hemangiosarcoma, hemangiopericytoma that arises from the pericyte of the blood vessel, Kaposi sarcoma that may be found in AIDS patient. Dear audience, today up to this about the glomus tumor briefly. Thanks all.